Good day, I'm Dr. Mitzi Fong. My pronouns are she or her. I'm from the Condesa clinic in Mexico City. I'm going to talk about the model in care in context of emergencies. This is our work team. We have a work team of a medical group, of social workers. Also, we have the community liaison of gender diverse people who work with us. I have no disclosures to tell. These are the contents of the presentation. The legislation in Mexico, we have to talk about the violence in Mexico, the policies in the Condesa clinic, the model of HIV prevention and care in the clinic, the Condesa clinic in the pandemic, the COVID-19 pandemic, and we're going to talk about telehealth and the future of the Condesa clinic in Mexico. First, we have to talk about the health flow in Mexico. It had to change 2009, so there will be a care program from transgender people. It changed, and it in Mexico City so that there will be a program that included hormonal therapy, psychotherapy, and also preventive actions to prevent STDs, and also if they had STDs treatment. And there a protocol for access to health without discriminations. The first edition was in 2017. The Condesa Clinic worked with the medical service in Mexico to make this protocol. Let's talk about the rectification gender identity in Mexico. In 13 states, you can change your identity. It's just legal, just tram it. So it's easier. You don't have to have a trial or nothing. You just want to change it. And in Jalisco, it was the first state that also you can change the legal identity, the legal gender identity for children and for adolescents. And then it was in Mexico City and in Oaxaca, and also in Morelos. So it's just a standard procedure. You go with your papers and you say, I want a recognition of my gender identity, and so you can change it. And this is the first state in Mexico who changed it. It's in Jalisco. I'm from Jalisco, so I'm proud of it. It's just also a procedure that you change it from childhood to adulthood. You can do it in Jalisco. In Mexico City, the law started. It was an issue since October or 2019, but then the COVID-19 came and it started to it wasn't approved. So a group of activists went and they have 15,000 signatures, so to discuss the law of child's transhood. So they approved it in 28th of August this year. So for 12 years old, you can change your identity in Mexico City. But there's had been a wave in transgender violence here in Mexico. There is systemic violence against women, and transgender women are women. So there's been, in Mexico is the second place in the world of transgender murders. So we're very worried about this. There's also discrimination in Mexico. There was a survey in 2018 about discrimination in medical service, and the majority told that they were uncomfortable with the medical attention, and they had to hide their sexual orientation or identity, and they thought like 40% that they didn't give the appropriate treatment, and also they have received discrimination of their co-workers with negative attitudes against their sexual orientation or sexual identity. So in Condesa Clinic in Mexico City, the program started in 2009 with free services providing hormone treatment, STD prevention and treatment, and also mental health as the consultation. There's been a change. There's been a growth in patients, 3% in 2 years, and it's been growing all these years. These are our numbers. This year we have 3,227 patients in Condesa clinic and Iztapalapa. There are 2 clinics who give hormone therapy. The mean age is 32 years old. There are 839 transgender men and trans women, 1,844. And non-binary, we have 51 patients. We started seeing by non-binary patients in last year. And the HIV prevalence has lower. Comparing to 2019, it was 24%, and now it's 21%. So we're very proud of the change. The service that we give in Condesa Clinic are STD treatment, HIV treatment, the prevention, the hormone therapy, mental health, condoms, post-exposure prophylaxis, pre-exposure prophylaxis, counseling. Also, we transfer to other healthcare services, and also hepatitis C treatment. That's the new thing. The care is first, the mental health professional see if the patient is depressed, and if they need help, so they can give the proper attention. So if they need sexual counseling, there's sexual counseling with the endocrinology consultation. It could be at the same time, but first it has to be without they have to be with treatment if they have mental issues. And if there are no transgender patients, well, we refer it to another healthcare because we specialize in transgender care. And what happens if the patient has HIV? So it has to be under control, less than 40 copies. And if there are less than 40 copies, we give them treatment. And then we have follow-up 3 months, 1 year, and later it's 6 months, every 6 months. We have medical consultation, laboratory tests, and also imaging with ultrasounds. And this is some of our photos of our clinic. What happened with the COVID-19? The transgender people are in risk because of their birth themselves, and they live in the margins and suffer the most. So we have to help them more, and they have problems accessing to healthcare, problems with socioeconomic, the impact of the crisis, and also the political crisis, because some of the laws that help transgender weren't approved because of the pandemics. And what kind of risk do transgender people have? Some of them smoke. There are some of them have disabilities. They are elderly. They have more than 60 years old. Sex workers. They live with HIV. They're homeless. They are working class or are poor. They could have conditions like diabetes, hypertension, cancer, and also trans or non-binary people have problem with sheltering and have rejection with their families and those who are in detention. So what happened in the COVID-19 pandemics? First, the consultation, we stopped until we could change the policies that we can give a safe environment, but we never stopped giving prescription and receiving consultation of urgent cases. If they have COVID-19, we refer them to, there was a hotline for assistance, long distance assistance, medical assistance for COVID-19. And then we started in August to change to give telehealth consultation. Now that there are less cases, we give mixed consultations because our patients, we have 10 to 16 consultations per day. There's oversaturation of the clinic. And sometimes the patients go to reschedule their appointment. So we have to change that. So you can reschedule appointments via WhatsApp or another app. And there's an inauguration of a new clinic that it's especially in care for non-binary or transgender clinic. So we can relieve the number of patients. We also have a rotation of residencies in endocrinology. This is the first rotation in Mexico, who is half a rotation in transgender health, also Congress, and give the telehealth consultations. So we change our policies so the patient can go less to the clinic. Before they have to go 6 times, 7 times, and now they just have to go. They can schedule their appointments by email, and then just go for the lab stamps, and the consultations can be by telehealth. And we have, this year was the all-time high for patients, 381 patients. It depends of how many medical systems we have, the oversaturation, if we have hormonal therapy, but this year was the all-time high. And let's talk about the Unidad de Salud Integral para Personas Trans. It's a health unit. It's just for non-binary and transgender people to provide services without discriminations. Well, there's the thing is that they have a first contact. There is a person within the gender diverse community to explain the services and give direct referral to the medical team or the mental health team. There's hormone therapy. There's also programs with treatment of victims of violence, also PrEP, pre-exposure, post-exposure prophylaxis, also PrEP, and hepatitis C treatment. So there's also community work that works with the Condesa clinic. Here's the group of Colectivo Trans and Andrea Luna. They deliver prevention supplies. They go to the sex workers, to the workplace, and they also identify community trans leaders so they can work with them and give them supplies, STD preventions, treatment, diagnosis. And there's a literacy group that a trans colleague who is a teacher gives them classes so they can receive their education. It first started in the Condesa Iztapalapa. So there's also in detention centers, they give talks, workshops, delivery prevention supplies, and there's also give pantries, and they work with the Condesa so the Condesa can give them supplies, but it's all their work. They work all the time to give, to provide help to all the transgender. There's also dining services. So, and in the near future, we want to have also treatment with adolescents. We are working with protocols. So in the unit for transgender and gender diverse people, we can include it. So the clinic, the Condesa clinic is funded by Mexico City, but it doesn't include other states. So we're working to provide policy so it could be nationwide. Also, we're working in transgender youth, so we can provide also treatment with GnRH analogs. And also as the unit, the USIP, it's work with the Condesa clinic to extend treatment to more transgender people. Well, thank you for your attention. So if you have any questions, these are my email, and thank you for your time.